everyone. I'm Dr. Asha Nagaraj, Professor and Head of the Department of Oral Medicine and Radiology and an implantologist. I have 21 years of academic experience and 26 years of my private practice. I have done national and international publications in my subject from past 21 years. I would like to talk what is the commonest problem which you face now in the due period of lockdown. The one and foremost which usually patient calls me up and tells they have severe toothache, and the second is the swelling of their face or near the tooth area. What is the reason for all these things? I'll let you know. The first and foremost is the long-standing, non-treated dental caries which invades into the pulp chamber. The pulp chamber is one where you have nerve and blood innervations, or the chamber which has nerve and blood. When this microorganisms enters into the pulp chamber, you will have severe pain and you patients can't sleep in the night. And what you do, the mistake is you just go and take a tablet and go to sleep. And the second most problem is the dental abscess. What is the abscess? It's a local collection of a pus. Dental abscess is local collection of pus in the root area. The most common features of all these things, what you will face when you don't treat this is the first and foremost, the swelling increases. When this swelling increases, you try to apply some balm on your face and try to apply some oil on your teeth or a tooth and try to put in hot fermentation, that is a hot pack on your facial area. This is very dangerous. Do you know why? This will cause a swelling increase. See, there are facial spaces in our head and neck region. There are around 16 facial space. This is a fibrous connective tissue which is there. We don't have a stiff skin on your face. It is very soft and flexible. So what happens when you put the hot fermentation or apply some balm on your face, due to the heat liberation, your pus will just accumulate in this facial space area, later leading to facial space infection, and this superiorly might get affected to your brain, leading to meningitis, later to brain abscess and death. When it goes inferior below your mandible, your submandibular space, which is called, when this space bilaterally involves with infection, you will lead into Ludwig's angina, when your breathing will be very difficult. So what is the advice I recommend you when you go for have an abscess or a toothache? First and foremost, take a lukewarm water and gargle your mouth thrice a day. The next step is kindly consult your family dentist who will help you. Call them up. They will definitely help you out. They will give you a prescription of correct dose of antibiotics and painkiller or an anti-inflammatory. You have to take the correct dose what they prescribe. If they tell you to take it for 5 days, you have to take it for 5 days. And if they give you a combination of antibiotics, you have to take that antibiotics combination. Usually patients say, no, doctor, heavy dose. No, doctor knows, a dentist knows how much antibiotic has to be given to a child or an adult patient. And the main thing which you people do is when you have an abscess or a toothache, you go to a medical store and take the tablets, a painkiller, which is very dangerous. For a long period of time, your kidney will get into trouble and your liver will get into trouble. This is not fair, isn't it? When your dentists are there for you, why don't you ask them? And second most thing is, when a child gets a pain, tooth pain, you give an adult dose of tablet, which is also very dangerous for a child's kidney. And the third one, where these medically compromised patients, where they have a kidney failure, where they have a cardiac problem, kindly, you don't prescribe any antibiotics. Doctors or dentists, professional dentists are there to help you out. They will help you. They will give a correct dose of tablet. Few of your painkillers are very dangerous for your kidney. The life of the patient is threatened. Kindly consider this. Kindly take the antibiotics according to the doctor, what he prescribes or she prescribes for you. And third one, the maintenance is very important for you. Kindly brush your teeth with the soft toothbrush, morning once and night once. Gargle your mouth after every eat what you eat. Nowadays, I think you people are taking a lot of snacks. Gargle your mouth or wash, just rinse your mouth once. And the third is floss your teeth every day and visit your dentist every 6 months. Dentists are your very good friends for your teeth. They want to preserve your teeth, not to destroy your teeth. Thank you very much. I am Dr. Asha Nagaraj.
I'm Dr. Aggrawal. I am a dental surgeon practicing in Jalandhar, Punjab. Today we are going to talk about the dental problems that we face day to day, and these are very important to take care of because they can be very disturbing in this situation when you are not able to go out. So first of all, you should be aware that to avoid any dental problems, you should be taking a good oral care with the help of mouthwash and brushing twice a day. And also I would recommend using betadine goggles twice a day, morning and evening, and use it undiluted and keep it in your mouth for around 1 to 2 minutes. So this will actually help you in maintaining a good oral hygiene. Then you should be having the claw oil and some gum paint handy in case you have some issue with the in the mouth in the form of swelling of the gums or pain. Now, dental problems can be actually differentiation. We have categorized it into essential and non-essential problems. The essential problems are the one which need to be taken care of now, which cannot be deferred till the time the lockdown is over. These are the pain and swelling. And the non-essential things are like you are missing some tooth and you want to replace it, you want veneers, you want teeth whitening. We should be only dealing with the essential things right now and forget about the non-essential problems in our dentition. So if you have pain, the best thing is to call to your friendly neighborhood dentist who will advise you the best course of action. So before calling him, you should be ready with the details like for how long this pain has been there and whether this pain comes and goes, whether this pain is there all the time, it is aggravated by something, or it is relieved by taking some cold water in the mouth or putting clove oil. So all this information you need to tell to the dentist, and then you need to know whether this pain is accompanied by swelling. So this swelling can be inside the mouth near the gum where the tooth is, or it can be outside on the face. If it is inside the gum, then it can be easily taken care of. No major problems will be there. But if it is outside the face, then it can be a serious condition. So you should be able to tell your dentist. Now about self-medication, I actually strongly advise you not to go for self-medication because there can be so many reasons for your pain and swelling, which a dentist can only understand. So just make a small video or a snap of the offending tooth, and then you send it to your dentist on email or on WhatsApp, and then seek his advice. Because all the chemist shops are open, so whatever advice your dentist will give you, you'll be able to get all the medicine. So there's no need to self-medicate. It is always very, very dangerous. About the non-essential things, you should not be worrying about at this point of time till the time everything is right. About the visit to the dental office. You should not be visiting the dental office unless you are called in by the dentist. If the dentist prescribe you something for 2 or 3 days and your problem is not going, then you should be able to fix an appointment with the dentist. We are all here to help you in this hour of the need. If your online consultation is not enough and your problem still persists, then you can book. We will call you in the office, and please be seated in your car and until the time you are called in. When you are called in, you will be given some protective gear to wear so that you are safe and we are safe. And one more thing, you should be carrying with you your mobile on which you have downloaded the Arogya Setu app. So that will help you in identifying whether there is any COVID patient near us or near you during the time you travel from your home. And in the clinic, we take care of everything. We do proper sterilization measures, and then we'll be able to treat your problem, and your issue should be resolved with our efforts. So be well informed and inform your dentist about your problem, and take good care of yourself, and this will help you in solving your dental issues. Thank you very much.
कोविड-19 आणि जागतिक महामारी पॅन्डेमिक आणि दाताचे आरोग्य. नमस्कार, मी डॉक्टर निकेत लोखंडे, एक दंतरोग तज्ञ असून 2000 सालापासून चिंचवड येथे माझा दातांचा दवाखाना आहे. मी 2000 साली माझी BDSचा अभ्यासक्रम पूर्ण केला आणि माझा दवाखाना सुरू केला. नंतर 2002 साली मी MDSच्या अभ्यासक्रमाला प्रवेश घेतला आणि 2005 साली माझा रूट कॅनल मध्ये स्पेशालिटी आणि रेस्टोरेटिव्ह डेंटिस्ट मध्ये स्पेशालिस्ट मी झालो. आणि त्यानंतर मी माझ्या दाताच्या दवाखान्यामध्ये सर्व दंतरुग्णांना रूट कॅनल आणि फिलिंग याचबरोबर सर्व दाताचे आरोग्य याच्याबद्दल सेवा देतो. आता नेहमीचे दाताचे आरोग्य आणि कोविड-19 पॅन्डेमिक मध्ये दाताचे आरोग्य यामध्ये काय बरं फरक आहे? फरक एवढाच आहे की नेहमीच्या स्थितीमध्ये सर्व दंतरोग तज्ञ सहजपणे उपलब्ध असतात, ज्या तुमच्या समस्या सहजपणे सोडवित असतात. सध्याच्या स्थितीमध्ये आम्हा सर्व दंतरोग तज्ञांना भारतीय दंत परिषदेने सर्व उपचार जे अतिआवश्यक नाहीत किंवा इमर्जन्सी नाहीत असे न करण्याचे सुचविले आहे. कारण आम्ही सर्व दंतवैद्य तोंडाच्या फार जवळ काम करीत असतो आणि रूट कॅनल किंवा फिलिंग करण्यासाठी जी यंत्रे वापरतो त्यामधून एरोसॉल तयार होत असतो. आता एरोसॉल म्हणजे काय? या एरोसॉल मध्ये पेशंटची थुंकी, पाणी आणि हवा यांचे मिश्रण असते. त्यामुळे हा कोविड-19 किंवा कोरोना रोग पसरण्याची खूप शक्यता असते. एरोसॉल मध्ये समजा पेशंटचा सलायवा मिक्स झालेला असेल तर पेशंट जर इन्फेक्टेड असेल तर हा रोग दंतरोग तज्ञाला किंवा डेंटिस्ट असिस्टंटला होऊ शकतो आणि उलटेही होऊ शकते. जर डेंटिस्ट किंवा डेंटल असिस्टंट जर कोविड रुग्णांनी प्रभावित असतील तर त्याच्यामुळे हा रोग पेशंटला होऊ शकतो. एका रुग्णामुळे दुसऱ्या रुग्णालाही हा रोग पसरू शकतो, कारण हवेमध्ये एरोसॉल बऱ्याच काळापर्यंत सस्पेंडेड राहतात. त्यामुळेच जवळजवळ देशातील 90%, रादर जगातीलच 90 ते 95% दाताचे दवाखाने सध्या बंदच आहेत. या सर्व बदललेल्या स्थितीमुळे दातांची नेहमीपेक्षा जास्त काळजी घेणे आवश्यक आहे. साधारणपणे दातांच्या कोणत्या समस्या उद्भवू शकतात? सामान्यतः दात खूप तीव्रतेने दुखत राहणे, दातांच्या भोवती, किडलेल्या दाताच्या भोवती हिरडीला अथवा गालावर सूज येणे, हिरड्यांमधून रक्त येणे, हिरड्या दुखणे, दातांमध्ये सेन्सिटिव्हिटी वाढणे, अक्कलदाढ दुखणे, मार लागल्यामुळे दात तुटणे व दुखणे, अशा अनेक समस्या या काळात उद्भवू शकतात. याचबरोबर हेही लक्षात घेतले पाहिजे की आधी केलेल्या उपचारांमध्ये सुद्धा काही अडचणी निर्माण होऊ शकतात, जसे कॅप निघणे, ब्रिज निघणे, दात ब्रिज सकट अथवा कॅप सकट तुटणे, कवळी तुटणे किंवा पूर्वी अर्धवट राहिलेल्या उपचारामध्ये वेदना निर्माण होणे, पूर्वी भरलेले सिमेंट तुटणे जेणेकरून दातांमध्ये अडकू लागणे, अशा वेगवेगळ्या समस्या उद्भवू शकतात. या सर्व समस्या जरी घरच्या घरी उपचार करून पूर्ण बऱ्या होणार नसल्या तरी त्याची तीव्रता आपण कमी करू शकतो किंवा ते वारंवार होणार नाही याची आपण काळजी घेऊ शकतो. घरच्या घरी तुम्ही काय उपचार करू शकता किंवा होम रेमेडी करू शकता जेणेकरून हे तुम्ही त्रास टाळू शकता किंवा त्याची तीव्रता कमी करू शकता. एखाद्या बाजूचा दात दुखत असल्यास त्या बाजूने खाणे टाळावे. कडक अथवा गरम त्या बाजूने खाऊ नये. हिरड्यांमधून रक्त येत असल्यास दिवसातून 3 ते 4 वेळा घरी कोमट पाण्यात मीठ टाकून गुळण्या करणे, हिरड्यांना मसाज करणे, वरच्या हिरड्यांना मसाज करताना वरून खाली, खालच्या हिरड्यांना मसाज करताना खालून वर बोटाची मुवमेंट करणे. मसाज करताना घरच्या घरचे तूप किंवा मध तुम्ही वापरू शकता. अक्कलदाढेमध्ये दुखत असल्यास किंवा हिरडी सुजत असल्यास कोमट पाण्यात मीठ टाकून गुळण्या करून घ्यावा. दिवसातून हे 3 ते 4 वेळा करावे. कॅप व ब्रिज निघाल्यास किंवा तुटल्यास तुमच्या डेंटिस्ट किंवा दंतवैद्याचा ला फोन करून कळवावे आणि त्याच्या सल्ल्यानुसार लगेच किंवा नंतर पुन्हा बसवून घ्या. दात खूपच दुखत असल्यास एखादी पेन किलर गोळी तुम्ही घेऊ शकता. तरी सुद्धा दात खूप दुखत असल्यास मी तुम्हाला असा सल्ला देईन की तुमच्या दंतवैद्याला किंवा डेंटिस्टला फोन करून व्हिडिओ कॉल करून त्याचा सल्ला घ्यावा आणि मग त्याच्या सल्ल्यानुसारच अँटीबायोटिक किंवा पेन किलरची गोळी तुम्ही घेऊ शकता. दातांची सेन्सिटिव्हिटी टाळण्यासाठी एकदम गरम व थंड खाण्याचे टाळावे. एकदम आंबट व गोड पदार्थ देखील खाण्याचे टाळावे. दातामध्ये शक्यतो काही अडकू न देणे. अडकल्यास ब्रश अथवा फ्लॉस याच्या साह्याने ते स्वच्छ करणे. परंतु कृपया टाचणी अथवा पिना यांचा वापर करू नये. त्याच्यामुळे हिरड्यांना इजा होऊ शकते. सकाळी व रात्री 2 वेळा व्यवस्थित ब्रशिंग करावे. शक्य असल्यास माउथवॉश वापरावे. आणि सगळ्यात महत्वाचे म्हणजे आपली प्रतिकार शक्ती वाढवण्यासाठी आरोग्यपूर्ण खावे. 45 मिनिटं रोज घरच्या घरी व्यायाम करावा. व्हिटॅमिन सी युक्त फळे जसे मोसंबी, संत्रे, आवळे, लिंबू यांचे सेवन करावे. प्रतिकार शक्ती वाढली की दातांमुळे सूज येणे, दात दुखणे असे बरेच आजार आपण टाळू शकतो. चला तर तुम्ही सर्वजण दातांची आणि तुमच्या आरोग्याची व्यवस्थित काळजी घ्या. ही वेळही निघून जाईल. तुमच्या आणि या सर्व डॉक्टरांच्या सहकार्यामुळे आपण यशस्वीपणे या कोरोना या जागतिक महामारीवरती, पॅन्डेमिक डिसीजवरती मात करू असा मला विश्वास आहे. धन्यवाद. चला काळजी घ्या.
This is Dr. Parminder. I am a practitioner practicing in Yamunanagar, associated with college, Himachal Institute of Dental Sciences. I am professor and head in pediatric dentistry. These days, due to lockdown, people are unable to reach our good self. So in this difficult situation, I am getting 20 to 30 calls daily of people who say we are in pain, we are helpless, we can't come, your clinic is closed. All such queries I am daily attending. The most common problem of people they really call is pain. Now pain is sometimes so severe that the person, they are not even able to sleep properly since so many days. They are not getting any dental treatment. So in this horrifying situation, what as a dental practitioner I am doing is, first of all, I just inquire the person, is your pain of the tooth aggravating when you eat hot and cold? Are you having very severe sensitivity? If the person says yes, then I tell him or her a very common home remedy. I tell him, do you have clove oil at your home? If he says yes, then I say, apply a drop on cotton and just place it inside the cavity which you are having. And I have seen it has relieved pain. Apart from this, I am usually prescribing these such symptoms with analgesics. I am prescribing diclofenac plus paracetamol or ibuprofen paracetamol, but I suggest everybody to just call your dentist before taking any analgesic. Secondly, if people they don't have clove oil, I say them just mash your clove into powder and apply it on the cotton. Then apply that cotton inside the cavity. That will relieve your pain. Plus, I prescribe them analgesic, and I have seen people they get relieved from that. Nextly, if the person say I am feeling pain on chewing. Now my question is, if it is unbearable pain on chewing, then I am usually prescribing them antibiotics along with painkiller. The most commonly prescribed antibiotic which I am using is amoxicillin, clavulate, 625 along with analgesics, diclofenac paracetamol or ibuprofen. But I would say always consult before taking any drug. Always consult your dentist before taking any drug. Secondly, I am also receiving calls regarding bleeding gums. I am saying do warm saline rinses twice or thrice daily. Some people have called because of pain in lower back region. They say they are feeling some tooth is emerging. So according to me, it might be a wisdom tooth that might be emerging. So I prescribe them warm saline rinses along with analgesics and appropriate antibiotics. Apart from them, bleeding of gums is also which I am receiving calls these days. So for bleeding in gums, I am recommending them warm saline rinses and astringents they can use. They are very commonly available in market. I am prescribing them astringents. I am telling them go to a chemist and apply. Tell them to give astringents which are commercially available. Apply them on gums. Bleeding will be relieved. Apart from this, I have even received yesterday. I received a call. The lady was saying that my tongue got injured to such an extent that I am neither able to sleep nor able to eat because of my sharp tooth. It broke. I'm not having pain, but tongue is hurting like anything. So I am sitting here. My clinic is closed. So what can I do? I had a simple answer. I said, do you have a nail cutter at your home? She said, yes. I said, the back of the nail cutter has a filer. Just boil that nail cutter and file your tooth with that. You will feel comfortable. And after half an hour, she called me again. Kedi, thanks a lot, doctor. It worked really good. It worked really good. And I was also feeling happy that my clinic is closed. At least my patients, they are getting relieved from severe pain and severe discomfort by these small tips which I am telling them or I am guiding them through telephone. Thanks to this social networking and this fast telecommunications with which we are able to reduce or minimize the patient discomfort. Thank you.